Democrats know that. They know that the mess they created, and I know they're trying to dump the problems of Obamacare off on everybody other than the people that actually passed and voted for Obamacare. Those high premiums are a result of Democrat policies. If they really wanted to work with us on lowering premiums, there are a lot of bipartisan ideas that you could come to the table and bring and do. And they've got to stop fighting the things that have been proven to work as well.
That is the number 2 House Republican Steve Scalise telling Punchbowl News that he would not vote to extend tax credits set to expire for the Affordable Care Act. Democrats have been holding out for an extension of those subsidies. The government now has been closed for 17 days over it. And though Republicans continue to be intransigent on the issue, Democrats do think they can make a deal with President Trump. Joining us now, MSNBC political contributor and co-founder of Punchbowl News, Jake Sherman, along with senior national correspondent for The Bulwark and author of The 10-Year War, Obamacare, and The Unfinished Crusade for Universal Coverage, Jonathan Cohn. Jake, why do Democrats believe they can make a deal with Donald Trump?
I don't know. I'm just being honest with you. I don't have a good sense about that. The president has shown no public willingness to do a deal. Now, he did say behind closed doors that he'd like to solve this. I think there are a lot of people up here in this building, in the Capitol, who want to solve this. Not many in the House Republican Conference, but a lot of Senate Republicans and a handful of House Republicans who want to get this done. They will not, unless they completely fold, which they are showing zero signs of, they will not do it when the government is closed. They are just dug in very deep on that. And let's just zoom out for 1 second, Katie, and talk about the political impacts. Excuse me. Republicans will get the blame if premiums skyrocket. I don't see a way around that, and most Republicans acknowledge that privately. So they have this problem where the vast majority of House Republicans do not want to solve this problem, and they still understand that they might get the blame.
So how does that make any sense, Jake?
I don't know. I don't know, because they see this as and it's not a vestige of Obamacare. This is a COVID-era policy that kept premiums in check on the ACA. And they don't like Obamacare. They don't want to spend a bunch of money on COVID, what they see as COVID-era policies. You know, they might end up doing a deal in the end if Trump does get behind it. But right now, Trump seems incredibly comfortable with sitting pat and letting Congress squirm, mostly letting Democrats squirm in his view, and try to work their way through the shutdown. He has just not been involved in any way and has let Mike Johnson and John Thune completely handle this thing.
All right. So, Jonathan, let's talk about what Steve Scalise alleged there to Jake at the top. And he's talking about that Democrats are trying to dump Obamacare's problems on everybody else, and that there are better ways of dealing with higher premiums. Are there better ways of dealing with them?
I mean, obviously, that's a matter of opinion. But in terms of dumping Obamacare's problems, let's look at what Obamacare accomplished. There were 45 million Americans with no health insurance before Obamacare. Now we have 25 million. That is a massive reduction. People with pre-existing conditions can get coverage now. People who were paying more for their insurance are now getting subsidies. So it's made a lot of progress. Republicans talk about it as a failure because there's real shortcomings and inadequacies to it. But it's really helping a lot of people. Now, these COVID-era subsidies that they added have made it an even better deal. You know, enrollment in healthcare.gov and the other exchanges basically doubled when they added this extra money. It's something they always wanted to do with the Affordable Care Act. You know, when they first passed the law in 2010, they had to make all these compromises. And they always said, look, this is a starter home. We want to add to it. Well, now they've added to it. And they said, look, we want to keep this going. We think this is progress. And that's the debate here. It's a real, genuine debate. Republicans look at this and say, wow, this is, $30 billion a year. That's a lot of money. We don't want to spend that. We don't think it's worth it. We could use that money somewhere else. Democrats are saying, well, what do you mean it's not worth it? People are getting cheaper health insurance if we don't spend this. The premium is going to double for more than 20 million people. And by the way, it's a lot of money, but it's a heck of a lot less money than you just spent on tax cuts for the rich.
You know, we talk about it as like an individual policy. It's individuals getting this health care. I heard a candidate, a Democratic candidate for office, talking about it in a different way. And this was to say that it's really a small business loan. What you're doing is you're propping up small businesses by extending this health care option. Can you explain that, Jonathan?
Yeah. So, I mean, one of the ironies of this is that when we talk about, you usually have debates with Democrats and Republicans on healthcare. So frequently it's, Democrats wanting to help. You assume it's Democrats wanting to help very low income people who can't afford insurance, on their own. They're very poor. And that's usually the way the debate is phrased out. But, when you look at who's actually benefiting from the subsidies and the Affordable Care Act, these extra subsidies in particular, there's a lot of farmers and a lot of small business owners. And those are Republican constituencies. And that's one of the reasons to what Jake was speaking to earlier about the political dilemma here they face.
So I don't understand then, Jake, why if it's going to hurt them, why they don't want to extend it.
Because let me just put it in another frame. Members of Congress don't always act in their own rational political interest. We see this over and over again. And I think,
or in the interest of their constituents. I mean,
right.
Rational political interests. I mean, it's people who need this.
Yeah, Jonathan has been covering this also. For the Congress, over the last 15 years, Katie, has been wrestling with the ACA. I mean, this is not a new idea, and Republicans, I don't think they would say this publicly, but Republicans see this as an opportunity to ding the ACA, a bill that they voted against, they campaigned against, and they spent a decade dumping all over as being inadequate and ill-conceived.
All right, Jake Sherman, Jonathan Cohn, gentlemen, thank you.